to have somebody who was an innovative thinker and very creative and was eager to get outside of the box. So you were definitely that person.
Hi, I'm Dr. Hutcheson, and with me is one of my longtime mentors and somebody that I used to work for, Dr. Ed Behling with Hope Health, the Chief Medical Officer. Dr. Behling, thank you for chatting with me today.
Oh, thank you. It's a pleasure to get together again.
And, over the course of the years that we've known each other, which has been probably about 8 or 9 years now, even though we had a lot of fun along our journey, most of the time we were, in suits and ties and in white coats and at meetings and working on developing programs and treating patients. And so it's just really kind of cool that we got to connect here while you're on vacation in St. Pete Beach, and we're all just got out of the ocean and feeling refreshed.
Yeah, get a little relaxing time mixed in. It's good.
Dr. Ed, I just wanted to kind of get to share with some of our viewers about really how influential that you were in my development and who I've become today, not only as a chiropractor, but just as a human being overall. It's pretty incredible because when I was still in chiropractic school, I knew that I wanted to work in an integrative health setting. And that was placed on my heart because of my brother Tyler that had debilitating scoliosis, and he ended up having Harrington rods put in. And I saw the benefit of him having both chiropractic care, needed a surgeon, in some ways needed medical management, and that there was a gap in providers communicating with each other, whether they went to the chiropractor or the medical doctor. And, they would almost be scared to tell a patient that they were going to both because the MD sometimes would say, don't go to the chiropractor. And the chiropractor would say, don't take those pills. And so it was like, I just saw such a void in there. And early on, when we first started the chiropractic program at Hope Health, it was October of 2014, which was still very early for an integrated program. And if you would just share a little bit about what you were thinking when you felt, this is the right time and, this is what we need to do.
Well, I think it was a very opportunistic time for both of us, honestly. One was that we were getting ready to start a pain management program. And pain management, frankly, most of the time is done wrong. So people focus on elimination of pain, and they just want to do that through pharmaceutics. So they just want to come, get a prescription, and head out the door. But pain is a multifaceted problem, right? I mean, it has a lot of elements that cause the sensation of pain. And so to treat it appropriately, you need a multifaceted approach to remedy that. And that's what we were developing at Hope Health. We had physicians there who had experience in pain management and writing controlled substances and knew how to navigate that process well. And we had behavioral health consultants. 2 of those actually had experience with addiction medicine, which was critical, I think, for the program because it really gave them a keen sense of when patients were maybe getting in trouble, and also kind of detecting when patients were struggling more with addiction or maybe with psychological pain, more so with physical pain. And so that component could be addressed very effectively through the behavioral health counselor as well as through the pain skills classes, so that they would help patients to do distraction therapy or biofeedback or other mechanisms to cope with their pain more effectively rather than just take another pill. But then the other aspect obviously was the physical component. I mean, we were a very, very sedentary society. Many of the patients at the pain center had had 4, 5, 6 back surgeries and had failed. So just mechanically, they were a mess. So we definitely, we would be remiss in the treatment of their pain if we did not address that critical component of their pain, the mechanics and the actual physical, both posture and body mechanics and those kind of things from a pain perspective. But in order to do that, honestly, it had to be a unique partnership. To your point, we had some physicians on our side who had maybe not had the best experience with chiropractic care in the back, and there was obviously a little bit of a conflict professionally on some levels. So I knew that to kind of fill that position, we had to have somebody who was different. who did not have that reputation, but somebody who was innovative, who was very collaborative, who had mutual respect. So, I know chiropractors look for respect from the medical community. Similarly, the medical community needed that mutual respect from a chiropractic partner. And I mean, you really came in at the perfect time and brought that degree of respect for the medical model, with the knowledge that there is a place for medication. There is a place for other avenues of treatment, that chiropractic care can't fix everything, just like medical care can't fix everything. To have somebody who was an innovative thinker and very creative and was eager to get outside of the box. So you were definitely that person that met that need at the right place and kind of pushed the envelope on things, which is exactly what we needed to do.
Awesome. Yeah, thank you so much for giving me the opportunity. And the program that you put together, and I was one part of helping design, still exists today. And
it does. So built on the foundation that you helped to build there, with a kind of the three-legged stool, as I call it, with chiropractic and behavioral health and medical, we're able to kind of grow the program and continue to expand also in the alternative medicine component. We have a alternative medicine physician who's joining us later this year. So we're able, and the program continues to be very successful. There's unfortunately a waiting list. It's so successful, we have a significant waiting list for patients to be able to get in to be seen.
It was pretty interesting because pretty soon after we started the program with the integrative model, they didn't hire behavioral health in pain management, but I'm pretty sure that a neighboring health center hired a chiropractor. And they saw the initial success we were having, and I worked really hard, as Dr. Ed said, to build respect between all of the medical doctors. And I think that you would agree that it was pretty quick that everyone was on board. I mean, we had almost, everybody referring and co-managing patients. When I saw a need, one time I found a rash on a patient on their low back that nobody knew was there, and it was really bad. So we immediately got her in with one of our nurse practitioners that was specialized in dermatology. She handled that before I addressed her low back problem. And, the MDs, when a patient would come in with back pain, before writing them a script, they'd say, go see Dr. Hutcheson. And we would start and see if it was a simple fix, mechanical, before. So we really helped to optimize and streamline a lot of these care plans. And in many cases, helped to lower the amount of pain medication that was needed to really take good care of all the patients. So,
absolutely. And that's one of the goals of the program, is to really reorient the patients to what is pain control. It's not elimination of pain necessarily, but improvement in functionality. Yep. So to enhance their quality of life, so that they can do things with their kids or around their house that they were not able to do before. That's kind of the goal of what the program is. It was definitely an evolution that was interesting to see how even some of our old school physicians that were maybe a little bit more skeptical of chiropractic ended up being some of your biggest referring sources.
It's pretty cool. You're right, Dr. Ed. It was definitely a challenge, and thank you for believing me to be up for that challenge, to really create this integrative model with one that had respect, integrity, and one that really worked. So it was a great privilege to be able to build that program.
Well, thank you. Being able to care for the patient holistically really is not only the way that healthcare is going, but it's the way that healthcare should have always been.
Yep.
So being able to do that from, not only a physical standpoint, but mental health, nutrition, kind of bringing all of those aspects of health together to optimize the health of the patient, I think is definitely the right direction. That's where we need to go.
Thank you for believing in me to have the ability to collaborate, with this integrative program. And, I feel like we did such a good job. I'm just very grateful that the program still exists, and I hope other health centers around the nation will follow with these integrative type pain management programs, because it's a great success. I mean, as Dr. Ed would tell you, we're able to more adequately set expectations for patients. We're able to reduce the reliance on just pain medicine alone, but give them many ways to cope with pain, and on occasion even to be somebody that got to get off of the pain medicine, which is always a big excitement for any and all of us. So over the last few years, I've ventured into trying to solve another problem or a problem, not something that's completely broken, but an area that could be improved. And I've been working exclusively on these really difficult upper neck cases. And I've shared a little bit over time with Dr. Ed about them and how subclinical neck problems can cause alterations in brain blood flow. You can get pressure buildup in your head from blood not exiting correctly. And it's getting worse with the pandemic or epidemic, of forward head, face down lifestyle. And just being a physician for so long and having kids of your own, 3 boys, how do you see the significance of people being on the computers and phones all day do you see it becoming a more significant problem and just in your experience?
Oh, well, you used the word epidemic earlier, and I think that's where we're headed. I recently, got back from Belize, and there was a small village where of Mayans who do very, very physical work all day, and they have bad backs and bad knees. Well, where in America, where we all have very sedentary lifestyles and we spend all day on some kind of electronic devices, definitely we're evolving where the neck is going to be the focus because of our bad posture, lack of exercise, even neck exercises to strengthen the neck muscles so that you can hold your head upright while you're doing your work, the lack of attention to the ergonomics to your office environment. All of those things, I think, combine just to make this, it is an epidemic. So you compound this on the epidemic we already have with opioid use. And I can say that freely because my generation of physicians are frankly who created. When I began into practice 30 years ago, the real catchphrase was pain is the 5th vital sign, and no pain needs to be left untreated. And opiates are safe, and the non-steroidal anti-inflammatories are poison, so give everybody opiates. So we've created this epidemic in society where not only opiates are just being written to free, but we've created this mantra of nobody should suffer, that any pain needs to be extinguished, and it needs to be done in a little bottle. So we're as Americans, we like to take the easy way out, and that's certainly the easiest way to remediate pain in the short term. But the long-term consequences, both of the opioid overuse and then the mechanical destruction that we're doing to our bodies by just staring at a blue screen all day, every day, is definitely, we're going to reap the benefits, reap the consequences to that down the road. And honestly, it's taken me about this long to forgive you for leaving the program.
Thank you, Dr. Ed.
No, but honestly, I'm very proud of the work that you're doing and the direction that you've had and all the success that you've had. So I feel like you're kind of an extension of Hope Health, that you were able to do some great things while you were working with us and continue to do great things now. So no hard feelings.
Thank you so much. And it really was not an easy thing for me to do, was to leave, because, as I said earlier, Hope Health has been the best job I've ever had in my life. And just because of the way that you guys run the company, everybody that works for Hope Health, meaning you can never get everybody, but I would say 90% of the people there are like cheerleaders for Hope Health because they love the company so much because of the culture you've built and the way that you guys think about the whole person and integrating, and it's just been incredible. So I hope to be able to take that with me, and I regularly think about how the lessons that I've learned from working with you, with Carl, with Mark, with everyone at Hope Health. And I hope that someday in the future, if we continue to be blessed with great success, that we're able to collaborate again in the future. So
I would love that. That's great.
Thank you, Dr. Ed. Thank you for your time.
Thank you. Appreciate it.